Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see another lecture that is related to the cardiac marker, and it is about the Hs CRP test. If you guys remember, we already talked about different cardiac markers test, like we have talked about the SGOT test, we talked LDH, we talked CKMB, we talked CPK. So all these are what? All these are the cardiac marker. If you want to see all these video lectures, so there will be a playlist into my YouTube channel. The name will be the cardiac marker test. So you can click on the playlist and you will find all these video lecture. Okay. Today in this video we are also going to see the Hs CRP test. So let's start. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Now what are the main content of this video lecture? So in this video we are going to see the introduction, when this test should be performed, diagnostic purpose, test procedure, normal range, main causes of high Hs CRP. First of all, let's see the introduction. So Hs CRP, the full form is high sensitive C reactive protein. Now this is actually a test in which we measure a very low level of what? A very low level of CRP protein. Okay, and due to this way it will give us a low grade or chronic infection, means it can give us an information about the low grade or chronic infection. As we better know that the CRP is the protein that is produced by the liver, okay, in the response of the inflammation in the body. Then we have that when to perform this test. So this test should be performed when there is high BP, cholesterol and TG, when the patient is obesity and having diabetes, when the patient have rheumatoid arthritis and angina. The normal range of high sensitive CRP is less than 1.0 milligram per liter. Sorry. Now let's see the diagnostic purposes. So this test is specially used to assess cardiovascular disease risk. This test is used to diagnose chronic and acute inflammation. This test is used to check treatment efficacy and disease progression. This test is also used to evaluate bacterial infections. This test is used to monitor the risk of heart attack or myocardial infarction. So this is the diagnostic purpose, that why we perform this test. Now let's see the requirement. So in this test you need the blood in gel tube, you need the blood in red top, you need the yellow tip, you need blue tip, you need a dry incubator and centrifuge machine. This is the fine care machine, or we can say immunofluorescence immunoassay machine. This is the Selectra machine, advanced machine. So you can perform the test so this is the semi-automated machine and this is fully automated machine. Okay, so we can perform the test by using any one of the machine. In most of the laboratory they are using FIA machine, means fluorescence immunoassay machines. So and in some of the advanced laboratory they are using the advanced machine, like fully automated machine like Selectra or Mendre, Meglomi, etc. Let's see the test procedure, how to perform the test. So it's very simple. First of all, you need to take the blood in the gel tube or red top, and then you will centrifuge the blood to separate the serum. After that you will run the test using a machine like Selectra or FIA. Dear friends, I already explained that how to perform the test using Selectra machine or FIA machine. So if you want to see my video lecture related, you will be present into my YouTube channel, how to perform the CRP test using FIA machine. Okay, I will also give the link in the description. I will also give the link into I button, so then you will click it and watch the video. Next we have the main causes of high Hs CRP. So the high Hs CRP is caused by atherosclerosis. It is the deposition of the fats in the vessels, and due to this way what will happen, there will be a pain, a chest pain, and there will be, angina, we can say and there will be a chance of the heart attack. So why? Because the fats will be deposited, and or high fats will be deposited into the arteries or vessels. Due to this way, what will happen, the blood will be not properly flow into the heart. Next we have unstable angina, pain into the chest, we can say pain in the chest. Next we have myocardial infarction, we also called it heart attack. Rheumatoid arthritis, pain in the joints. We have systemic lupus erythematosus, that this is the autoimmune disease. Inflammatory bowel disease, like we have Crohn's disease, gout disease. We have obesity, we have type 2 diabetes mellitus infection like bacterial or viral, acute trauma injury, cancer like a lymphoma, chronic liver and kidney disease, smoking. So these are the main conditions through which the Hs CRP get high in the body. So this is all about the Hs CRP. I hope you understand. If you understand, so best of luck. If you like this video, so make sure to hit the like button, share this video, and definitely subscribe my channel to get more interesting videos like that. If you have any question in your mind, you can write your question into comment. I will try my best to give you answer as soon as possible.